Hello, everyone, and welcome back to the Revenue Cycle Decoded podcast. I am your host, Gina Cornett, and we are talking about all things revenue cycle. I hope you'll forgive me today. I have a little bit of a cold. I had grandchildren here for the holidays, and so they are spreading the love. That's all I can say. So, how are we going to make 2025 our most successful year yet in revenue cycle management? No matter what your role is, implementing best practices can really have a huge impact on your organization's bottom line and on your career. So, in today's episode, I'm going to give you my top 10 revenue cycle best practices to make sure you have your best revenue cycle year ever. These practices are actionable, they're effective, and tried and true, and designed to help you improve your efficiency, reduce denials, and deliver better results. So stick around for the whole podcast. You're not going to want to miss number 10, which will tie it all together with a bow. So let's get started. So, if you've been listening to these episodes for a while, you'll know that I strongly emphasize front end revenue cycle because it is so very important. You folks who are in patient access, you are the key to an effective revenue cycle and to reducing those claim denials and making sure we get the revenue that we have earned by providing the services that we do. And so the foundation of a smooth revenue cycle starts in the front end. And if patient registration or insurance verification or eligibility are incomplete or inaccurate or not done at all, and I know there are some practices that are not running eligibility and benefits verification, you might want to think about how to implement that. So if you're not doing those things, that entire cycle can unravel. So here's what to focus on in 2025. Ensure that your patient demographics are entered accurately. And one way that you can do this is to audit. Audit what's being entered. Check 10 encounters a week or whatever number feels comfortable to you, and make sure that information that's in your system is accurate. And if it's not, then it's time to talk to the front end revenue cycle staff. Or if you're the practice manager, or if you are the front end revenue cycle staff, have someone double check your work sometimes and just make sure, give it that extra look to make sure that you're not transposing letters and numbers. You're getting all the information there that needs to be there. Verify insurance eligibility in real time before services are provided. There are payer portals. There are different services like Availity or Passport, which you can use. And this is so important because if you have provided a service that the patient is not eligible for, either because it's not covered by their plan or because their plan isn't active, maybe it's been terminated or it's outside the dates of service, for any of those reasons, you're going to get a claim denial and you may not be able to recoup that. So this is a really important step. Obtain and document prior authorizations when those are required. And payers may be updating their prior authorization lists and the services and procedures that require them throughout the year, but especially this time of year, it's a great time to go out to the payer websites or portals for the payers you see most in your practice, pull their prior authorization requirements, keep those in a binder at your front desk or whoever it is that is providing or completing those prior authorizations for you. Make sure that you know which services need those for which plans and get those prior authorizations and get it in the right place in your practice management software so that it goes out on your claim, because you don't want to get denials for lack of prior authorization. You might be able to get a retroactive authorization, but that's not guaranteed. So best practice, and we were focusing on our best practices here, is to get those when they're required. So think of the front end as your first line of defense against denials. Training your staff, or if you are the staff, learning to collect the right information up front, that's really going to save you a lot of hours and a lot of dollars down the road. All right, now tip number 2, automate wherever possible. It is your best friend when it comes to streamlining the revenue cycle. From doing those eligibility checks, if you can use portals or you can use gateways or provider websites or Availity or Passport or one of the other services that will automate that for you, that saves so much time. You do not want to have a person from your staff sitting on the phone waiting to get that information. Also, claim scrubbing. Update your edits in your claim scrubber. Make sure that they match what's required by your payers for the year. If there's changes in the payer policies, you want your edits to reflect that. And those automated edits are going to go through your claims and make sure that the information that you're submitting is what needs to be submitted and is going to match the payer requirements. So that's going to reduce those manual errors and improve your efficiency. Denials management. So there's beginning to be more and more AI tools, and there is some uptake of them amongst practice managers and administrators to categorize and prioritize denials for resolution. Now, whether you're allowing AI or an AI solution to completely manage that denial process, I don't know that those solutions are there yet. And I don't know that administration professionals trust that they are there yet, but it's certainly worth looking into how AI solutions could help you in managing your denial process. There are some solutions that are beginning to be developed that research medical policies and will pull the payer policies then to be able to attach it to an appeal letter or to write those appeal letters. So consider looking into how you might be able to automate your denial process. So it's no longer optional. I mean, we have left the dark ages of all paper records. We left that a long time ago, and it's really necessary with the volume of patients and the number of claims that are submitting and going to clearinghouses. In this day and age, we really have to automate wherever we can to try to stay competitive. It's an increasingly complex landscape. All right, now tip number 3, strengthen your denials prevention and management. Well, we started already with our front desk, right? So, did you know that 90% of denials are preventable? And I've read different statistics, but anywhere from 45 to 65% of denials just get written off rather than worked and resubmitted or appealed. So, that's a lot of money to be leaving on the table. And we'd really rather not do that, right? So preventing denials at the source should be a top priority for every revenue cycle team. So some of the things that you can do, we've already talked about the front end, but we can also focus on root cause analysis. If you're starting to see some trends in your denials, you really should be tracking and trending the denials that you're receiving. Once you identify those trends, then we need to get down to the root cause. We don't want to just make an assumption that we're getting these denials because Susie at the front desk is lazy, right? We don't want to say that's our root cause. We really want to get down to what is the root cause. So do some root cause analysis. And if you're not sure what that is, my Front-End Denials Decoded course will teach you what root cause analysis is. And that lets us identify why denials are really happening, and then we can address that root cause. So another way that we can prevent denials from happening is through some front-end checks. We want to make sure that we're doing good documentation, that our providers and our physicians understand the payer requirements for documentation. What needs to be in that progress or that procedure note to make sure that the claim will be paid and that it also won't later be recouped down the road. What's required for authorizations? What's required for coding? We want to make sure we're coding our claims correctly. So auditing can make sure that you're doing that. And develop a streamlined process for appeals with complete and accurate information. So, first of all, it may not be to your benefit to appeal every single denial you receive. Timely filing denials, if you didn't file it timely because the physician didn't complete his documentation, you're out of luck and it's really not worth your time to try to appeal those. But If it's a large dollar claim and you filed it timely and the reason you were denied doesn't make any sense, especially you've researched your payer policy and come up with, that doesn't make any sense. That should have been paid. Then yes, you need to be researching and you need a streamlined approach to do that. So whether it's prioritizing your high dollar claims or your most recent claims that have been denied, you want to have a process in place and follow that process and ensure your staff are following that process. And then you can automate your appeal letters. You can have templates created in your system, or your practice management system may automatically generate those. So consider how you might automate and make that process streamlined. Because remember that every denied claim, that's lost revenue until it's resolved. And a proactive approach will really help you to resolve those losses. So tip number 4, invest in staff training. Okay, guys, I'm just going to say it. Our front office people don't get enough training. I'm just going to say it. It's out there. I'm saying it. We see many people come in to work in the medical front office, the physician front office, or outpatient front desk, patient access positions, and they may not have received a whole lot of training, and they may be expected to learn it on the job. And the same thing for billing. I've seen that for billing. I've seen that for other positions in the practice. And these folks need training because they need to understand how important their role is to the revenue cycle and to patient satisfaction. And the way they get there and do their jobs well and want to stay in their jobs long term is training. And so it's on practice managers and administrators to make sure they get that training. So they're your most valuable resource. They're the people your patients see every day. And they're the reason your patients keep coming back, in addition to, of course, your providers. So regular training ensures that they are equipped to handle the latest regulations, payer requirements, and technology tools. And so some of the things that you want to include in your training programs would be any updates to payer policies. Again, it's a great time of year to go out and see what your payers are doing. And many of your payers have educational webinars. Did you know that? So look on their websites to see if they offer education. Get your staff signed up so that they can listen in. This also goes for CMS and for your Medicare administrative contractors. All of them have educational materials. CMS has the Medicare Learning Network, and they have put out the MLN documents. And then each of the MACs offer many, many webinars that are available for your staff to sign up for. And some of them even put them on YouTube. So make your staff aware of those resources and give them access. And then you may want to consider paid training for your staff as well. I have several options. There are many companies out there that have revenue cycle options for your staff. And so get your staff enrolled in training and upskill them, help them to learn to do their job better. Some other things that they can learn: best practices for patient financial engagement. If you're the practice manager or the administrator of your department, involve your staff in role plays, especially if they're not quite so comfortable with these financial conversations with patients. Help them to know what to say, help to develop scripts for them. And then some hands-on training on revenue cycle tools and software. Make sure that they know how to use portals and gateways and applications and your practice management software. Make sure they know how to run the reports that they need to do their job. We all know that a well-trained team is more confident, they are more efficient, and they are better equipped to tackle any challenges that come their way. Tip number 5 is to leverage data analytics. Data is king. And I think we all know how important data is to our KPIs and our benchmarks. And for those of you who don't know what a KPI is, that's key performance indicator. For revenue cycle, there are some specific key KPIs that we look at. So those analytics are going to give you some critical and invaluable insights into your revenue cycle performance and help you identify areas for improvement. We want to look specifically at things like clean claim rate, and that is the percentage of claims that are submitted without errors. They go right through the clearinghouse and straight to the payer. So we're not getting any rejections on those. Our denials rate, what's the percentage of claims that are being denied? Our days in accounts receivable, that's the average time that it's taking to collect payments. Those are really important analytics to pay attention to see how healthy your practice is. So when you regularly analyze that data, you're going to start to spot trends and identify bottlenecks and make some data-driven decisions that will influence your outcomes. Tip number 6, enhance patient financial engagement. We all know that our patients are responsible for paying more out of pocket than ever before. And that means we need to give them clear communication about their financial responsibilities. That's critical information. We know a lot of patients don't understand their plans. They don't have a clue, I'm telling you. And telling them that something is going to be paid for by their insurance plan, you have to be really careful about the terminology that you use. You might say, well, your plan covers this. Your patient hears, my plan's going to pay for this, but they may have a deductible that they haven't met yet. So you have to be and train your front office staff or whoever is having those conversations with your patients. They have to be trained to be very, very clear on the terminology and maybe even explain that terminology. Now, we may not know every single nuance of our patient's plan. It is on our patients to confirm their benefits with their payer and to find out from their payer what services and procedures are going to be covered and what they might be out of pocket. But at the same time, it's on our offices or our departments to be providing them with estimates in some cases. So if we're providing an estimate and we're getting that information from the payer, because we have run those eligibility and benefits verification checks like we should, and we've gotten information on their deductible, their expected out of pocket, what they've met so far, we can provide that information to them and give them a pretty good ballpark figure, but we need to remind them that it is an estimate and that we may not know what the provider is going to do when the patient is back in the treatment room, or that something else might be discovered that the provider has to take care of in the midst of a surgery. So we are providing them with an estimate, and we have to be careful to describe this service is covered. Here's what your deductible is that you still have to meet. This is the information that's been provided to us by your insurance company, your payer. But there could be other claims that are crossing over. And so it may be less, and your max out of pocket or your coinsurance may be more, depending on what procedures or services are performed. So this is our best estimate today based on the information that we have. So again, this is where role play and some scripting can really come in handy for your patient access personnel who are having these conversations with patients. It's important to understand when we have to provide a good faith estimate according to the No Surprises Act and other legislation that might be effective in your state. It's important to offer flexible payment options such as plans or discounts, and to use patient-friendly billing statements and portals. And all of these practices are important because when patients feel informed and feel supported, they're more likely to pay their bills and less likely to switch providers. They're also more likely to feel satisfied and happy with their financial service from their provider and to trust the provider more. Now, best practice number 7 is to focus on revenue integrity. And that means that we're ensuring every dollar that is owed to our organization is collected while maintaining compliance. So some key areas to focus on here would be charge capture. You really want to have accurate charge capture, and we confirm that through audits and through reconciliation. You need to ensure that every encounter on your calendar for the day has an associated charge. You need to review the documentation so that you are billing and capturing charges for every billable service that you provided. Coding audits should also be performed to identify and correct any errors. Keep in mind, some areas for audit would be modifier 25 or modifier 59 usage. Those are always big ones with the OIG. So If there are special procedures that you perform in your practice, you also want to make sure that you're auditing that documentation, making sure it meets the requirements according to payer policy. So really collaborate and look to collaborate between your clinical and your billing teams for complete documentation. Make sure the clinical teams know what documentation is required. And sometimes that takes the billing team or the coding team to provide education to your providers and your physicians. Revenue integrity is not just about compliance, although compliance is very important. We want to make sure that we are billing for every penny that we can, but not for a penny more under the law. So we want to maximize our reimbursement. We also want to build trust with our payers and our patients who recognize that we are billing honestly and correctly. Best practice number 8. Build a collaborative team culture. Revenue cycle to success, it really depends on collaboration. Whether you're a small practice and there's 3 or 4 people that have to, talk to each other every day, or whether you're in a large organization with multiple departments, patient access, coding, billing teams all have to work together seamlessly. So, one of the ways that you can encourage collaboration is to hold cross-departmental meetings. People tend to get into their silos. They're used to working with what they work with every day, and they may not understand what's happening in the other departments. So, if you're in a larger organization, you have billers, coders, they may never talk to the patient access folks. So, if you can get them together, that gives them the opportunity to share their experiences and to share best practices. And this really works when you're trying to resolve and prevent denials and get to those root causes and then to come up with a prevention plan, because those people on in the different departments, they need to talk. The billers need to tell patient access, this is what we're seeing. We're seeing errors coming across because eligibility was not confirmed. We're seeing a lot of new patients at the beginning of the year, right? Everybody's insurance plan is turned over and people have new plans, new subscriber numbers, but we're not capturing that. So we need to go back and make sure that we're getting accurate information from our patients. Well, your patient access staff, maybe they weren't trained on that. Maybe they didn't know. And so this is valuable information for them. Now they know how to do their jobs better. And it's not accusatory. It needs to be collaboration. We're working together. We're trying to make each other's jobs easier, right? Sometimes we need to kind of throw in a what's in it for you message to people. So we also want to make sure that everybody understands the goals and the metrics of the organization. You have a KPI that you're trying to reach. Maybe you're trying to improve your clean claims rate, or you're trying to decrease your denials rate. You want everybody on board with that KPI, and you want it to be something you talk about at every meeting, and everybody's working towards that goal, and they understand what their piece of that goal is. And then we want to use collaborative tools. There's so many things out there now. You could have, maybe we used to have a big whiteboard, right? We're tracking our benchmark on a whiteboard. But now we've got, shared dashboards, we've got Slack, we've got Teams, we've got Zoom, we've got all kinds of different ways to share things and communicate. And so we want to make sure that we're communicating those goals and those metrics and what we're striving for, and positive messages across our organizations. Because when we're creating that united team, they're going to be more efficient, they're going to be more innovative, and they're really going to be better equipped to handle the challenges that are coming up. Now, tip number 9 is to stay compliant with regulatory challenges and changes. And we know our regulations are always evolving, and so staying compliant, that's not negotiable. We have to be compliant. So monitor your updates from CMS and your payers and your professional organizations. We recently had things like the Medicare Physician Fee Schedule final rule that came out. You may not want to read all the pages in that final rule, but make sure you're aware of what's going on with your area and anything that's going to pertain to your practice or department. The outpatient prospective payment system final rule, the home health final rule, all these different final rules come out from CMS. And the MACs are going to be releasing their own rules or their LCDs, and payers release their own payer policies. So stay up to date for that. Sign up to their email distribution list and make sure they're not going to your spam folder. Check your professional organization, see what they're releasing, because a lot of times they're going to have news. HFMA and AAPC and AHIMA, they always have news about what's going on. And so you can keep up with those organizations. MGMA is another great one. And you know what? There's the informal networks as well. And I get so much information just monitoring my LinkedIn feed. If you connect with the industry experts, you're going to see a lot of information come across your desk that's going to be really valuable to you. So pay attention to what's coming across from all those different sources. And make sure that as you receive that new information, that you are training your staff on any new rules and requirements. You know, a couple of years ago, we had the No Surprises Act come out with a lot of requirements around good faith estimates. And still today, I hear some people who are either not creating good faith estimates, or they don't know what the No Surprises Act is about, or they're not really clear on the requirements of the No Surprises Act, or they think they know, but they're just not sure. So make sure that you are training your staff on these new regulations or requirements that come out. And then when you have a big one that comes out, make sure that you are conducting regular compliance audits so you check and correct issues early. Proactive compliance efforts protects your organization from penalties, and it maintains trust with your patients and your payers. And finally, tip number 10, we are at the end, getting close. So the last tip, last but not least, don't set your revenue cycle processes on autopilot. Do regular reviews and adjust as you need to throughout the year to stay competitive. And that means reviewing your metrics monthly to identify trends, where you need to correct or where you need to educate, adjust your workflows as you need to address any bottlenecks that are occurring, and gather feedback from your staff and your patients for opportunities to improve. When you are continuously improving, and I believe in a philosophy called CANI, constant and never ending improvement, that ensures that your revenue cycle will always be running at your best. That's it. If you are ready to implement these best practices and take your revenue cycle skills to the next level, I have already mentioned my revenue cycle bootcamp courses, but also would strongly encourage you to look at my front-end denials decoded course, because in that course, I go through some of the most common causes of denials that originate in faulty front-end processes, how to conduct a root cause analysis, how to create a performance improvement plan, and how to train your team to prevent as many as possible of those costly front-end denials. Check it out at revenuecycledecoded.com. Thanks so much for watching. And if you found these best practices helpful, don't forget to like, subscribe, and please share this video with your team or with someone else that you think would enjoy it. If you've got a favorite revenue cycle best practice tip that I didn't cover, I would love to see you drop it in the comments for the rest of us. And we'd love to hear from you. So see you in the next podcast episode. Peace out.